If anyone knows me, this is like my favourite song. I was 10, I still think of that day, now and then, and a crowd of thousands. What is my dad saying? Hello and welcome to the video. Today, I don't know if you can tell, I'm in some other clothing which isn't normally my clothing, but I am wearing my A&E staff nurse uniform because I have qualified after 3 years! 3 years. I mean, I know that's 6, but 3 on each side, so 3. Oh my god, I can't believe how quickly it's gone. So much has happened in 3 years, to be honest. It's actually crazy, and the fact that I got my dream job, I am very proud of myself. Very proud of who I've become over the last 3 years. Oh, it's emotional. So because I've done a first year nursing experience, second year nursing experience, I thought I would do my final year of nursing experience and then a little bit about my job that I'm starting very soon. Because as you can tell, I've already got all my uniform and my badge and my clock. Let's go back to the beginning. I have got my laptop down here. I'm just going to be using my laptop to guide me through the modules that I did in my third year of nursing and anything that I found helpful. I remember, I don't know if I put it in my second year of nursing vlog. I remember people saying to me that third year was a lot easier than second year because second year was quite hard. I had a lot of stuff happen at the beginning of second year and there were exams sort of, and it just wasn't an easy year, to be honest. Let's wind back to last year. This time last year, I've just started my third year. I was very naive. I was thinking, oh, this is gonna be alright. I got through second year, it's fine. If I could go back and tell myself, no, you have to work extra hard this year. First started with about a couple weeks at uni and then went straight onto placement. So the couple weeks was sort of all the module intro stuff. So I didn't actually have that many essays this year. I had like two at the most. The rest were exams. First off, we started by looking at our dissertation and what we were going to be doing for dissertation. Now I chose to do the management of the 4-hour wait time in A&E. Where am I working? A&E. But this was just a topic I always wanted to look at, and I have an interest in A&E, so I knew I wouldn't lose sort of interest in it. I know that's me repeating words, but basically you need to choose a subject for your dissertation that is going to be interesting and that you're not going to get, you will get angry with it, but something that you're actually interested in, because if you're doing it on something that you don't care about, you will just get pissed off with it, to be honest, and not want to do it at all. So I had sort of 2 practical exams, OSCE things. So I had something called a medication viva, which is where we had to learn a load of medications, a load of drugs, a load of group of drugs, and this feels so long ago now. We had to learn the uses. So this book is amazing. It's called The Top 100 Drugs. It's literally got all the different types of drugs at the beginning, and within each sort of type, so you've got like the classical like antiemetics, ACE inhibitors, beta blockers, that sort of thing, statin, like, you know, sort of your basic drugs that you need to know. And in it, it's got the common indications, the mechanisms of action, so how it works in your body, side effects, warnings, and interactions, which we needed to learn for about, I genuinely cannot remember how many it was, but it was a lot. I remember practicing on so many people and being like, test me, I need to know, because yeah, it was a lot of practice. Thanks to everyone that helped me with that, because I passed that. I did quite well in that as well, so yeah, I was very happy with that. So then I had our enhanced clinical assessment and decision making OSCE, where we had to learn 3 assessments, which was a cardiac assessment, an abdominal and swallow assessment, and a respiratory assessment. I definitely liked the cardiac assessment out of all of them, just because I prefer cardiac stuff, it just interests me more. But obviously it's important and you need to have a good general assessment, if that makes sense. So it is a useful tool for anything, especially when in A&E, because you need to have your assessments for different parts and people come in with different things. I recorded myself making all my assessments. I can't tell you how many times I've practiced on people. I mean, I practiced on my boyfriend at the time and my parents and my friends, my sister, myself. I used to do it to myself. Like, I know it sounds weird, but I would listen to my own like heart and stuff. Yeah, it was a lot of work, we'll see that. So I think I've still got my voice memos of it. I listened to this with my friend Amber the other day. Oh, it's so embarrassing.
Cardiac assessment. A torch to the living. Ensure that you inspect conjunctiva and sclera, the right part of the eye. The corneal arcus is discoloured ring around the edge of the cornea, could indicate high lipid levels.
Still got it. I've still got it. Yeah, I've got all my assessments recorded on my phone still. I passed that, did really well on that. Yeah, so I got 68% on my enhanced clinical assessment, which is good. That is like a solid high 2-1. So I finished my degree with a 2-1, which I am so proud of, super proud of myself for, because I would not have thought like a few years ago with the A-levels that I got that I would be getting a 2-1 in a nursing degree, which has not been easy at all. I also had my maths exam like I have every year. We have to get 100% in our maths exam in our final year. I got 100% on my first go, which was great. So basically it entails us drug calculations, IV calculations, and like figuring out drops per minute and stuff like that. It's not too difficult, but it requires a bit of practice and stuff, which, yeah, like it's like any exam sort of thing, but it's not the hardest exam. Then in January of this year, I had my leadership exam, which is about like team working, communication, leadership and all that sort of styles, and you have different leadership styles. It was a written exam, 2-hour written exam, where we could keep taking a crib sheet with us, which is an A4 size piece of paper with little notes on it. So took that one in, did really well on that one. I can't remember exactly what I got, but I did well. And yeah, that was a good exam. It's stressful though, because obviously you have to revise and you can't just fit everything on the crib sheet and stuff. It has to be a specific size font. So it was a lot of acronyms I wrote on it. It was essay style as well, so I think each essay was like 50 marks. I genuinely can't remember, it's been so long now. But yeah, it was an essay style exam, and I'm not the best at essay style exams, but I'm not the worst. We move on to dissertation sort of stuff, which I've slightly spoke about already, but not majorly. So we get given a dissertation supervisor. I was given my dissertation supervisor. We only met up a couple of times, which was a little bit stressful, but I just got on with it sort of thing. Yeah, it was alright. I was quite happy with my dissertation. I do wish I'd sort of done a little bit better, but you know, that's my own sort of doing. I should have worked harder at it. I think because we had a lot of things going on at the same time my dissertation was in, I passed it, so that's fine with me. And our dissertation was due in at the end of May, I believe. And this was sort of, I think we had all our exams around the same sort of time, which was very stressful. Then we had our end of life care essay due in middle of June, because I went away on holiday when it was due in. So I had to hand it in a week or so earlier. It was when I went away to Fuerteventura, which I'll link the vlog below if you haven't seen it. I had to hand in my essay a week or so before. That was a bit stressful. It's alright, I got through it. One of the other books that I would really, well, 2 books that I would really recommend is this BNF, which is the BNF. I mean, this is a little bit outdated now. I think it's March 2019, and obviously it's not March 2019 anymore, but they are pretty much the same. They come out every 6 months. I think you can get the app, which is completely updated anyway. Just don't have room on my phone. I do prefer the paper copy though, to be fair. I think it's because I've grown up with it. Then another good book that I really, if you have any interest in emergency medicine or emergency nursing, this book, the Oxford handbooks, are insane. They just have everything you need to know, like cardiac emergencies. It just has so much stuff. Like, it's got everything about cardiac arrests, including the 4 H's and 4 T's, and there's so much stuff. You've got your basic sort of bloods and what. A friggin' amazing book. Yeah, I am trying to learn how to read ECGs at the moment, which are also called EKGs, I think, in America. So I actually start as a staff nurse at the beginning of November. I am still working in A&E as a healthcare assistant at the moment, just to earn a bit of money, which is nice. I will be working 37.5 hours a week with doing shift days, so 12.5-hour shifts, usually 3 days a week, sometimes 4. I'll probably be doing bank on top of it, so I can get a bit more money as well to begin with, and a bit more experience as well. But the place that I work in A&E is like amazing. Everyone is just so nice there. The staff are amazing. It's such a nice A&E, to be honest. Like, I've never felt more welcomed on placement. Talking of placements though, we'll talk about my placements I've had this year and what they were like. Back this time last year, oh my god, I was on placement this time last year. So I was on placement on a fractured NOF ward, which is a fractured neck of femur, which is your hip. So fractured hips. So you can imagine the population that I was getting was quite elderly because not many young people fracture their hips. So it was a sort of an elderly placement, and elderly medicine again, which if you've seen my other videos, I've had a lot of them. I don't hate elderly medicine, but it's not my favourite, and I'm more of a trauma kind of person, and all that high sort of running around with like your head like, we need this, no, give me that, no, pass me that, no, I need that, I need some tongs, I need that, I need some scalpel, IV lines, that kind of thing is my, I prefer high pressure systems and that sort of thing, yeah. Working in a ward again wasn't my favourite. Praise to the people and the nurses and the doctors and everyone who does work on a ward, because props to you. With that in mind, I then got through this placement. It wasn't the easiest placement. I had show week halfway through it, which I had to take a week off for. I was a bit ill after as well, had a urine infection. There was issues with the staff not liking me. I was left on my own in a bay of 2 bays actually, told to look after them. I'm a student, I'm not supposed to be, I'm supposed to be supernumerary, but I was told to look after these bays. I would say you have to check this and stuff, and I don't know if they ever did, but it was on their pin because they signed for it, so like I have to say how it is as a student nurse, I'm not gonna lie. After that placement was done, because that just was a very stressful placement for me, I then found out I had A&E as in my next placement, and I was buzzing, so happy. I also had it with one of my best friends who also works in A&E with me now, Frankie, and she had it at the same time as me, so we were both in A&E at the same time, which was awesome. So I was there for 2 months in February and March, and the team were amazing. I got there day one, I was like, no, I can't go anywhere else, this is me. I love it so much. It's hard, it's so hard in A&E sometimes because you do get really sick people and they're so vulnerable and depend on you for so much stuff. It's scary, it's very scary. As a 21-year-old woman, like, I'm not that old and I'm doing a lot for someone my age. I'm just blown away by it all. What you can achieve in such a short period of time is insane. If you put your mind to it sounds like an inspirational video now, but if you put your mind to it, you can get where you want to go. You will do it. You can do this, you got this, you go girl, you do you, hun. I fought so hard. I literally fought my arse off to get A&E as my management placement. I was due to be on the emergency floor, then changed and spoke to so many people, including the matron in A&E, and was like, look, I would love it if I could have my management here because I so want a job here. She spoke to the guy, I then spoke to the guy, it all got sorted, and then your girl had A&E as her management. So I had A&E for 3 months after that, so mid-June to the mid of September, which was amazing. I never learned so much so quickly, literally. It was just, I loved it so much. Everyone there is amazing, as I've already said. They're just such a nice team and they're so supportive, and I've already got training next week for A&E and stuff. Like, my mentor was amazing. Both my sign-off mentor and the mentor that I worked with at the time, like, they were just literally got me through, because I didn't have the best time at the beginning of my management placement. Some stuff happened in my life and it was stressful, I'm not gonna lie. Like, I don't need to talk about that because it's happened. I've qualified. Like, the day I had my exam, after I found out I cried. I was so happy. Like, at the beginning of my placement, I didn't think I was gonna do it. I genuinely was like, I'm gonna have to drop out. I can't, like, my mental health was not good. Yeah. A lot of things weren't going great, but I mean, look at me now. Look at me now. Yeah, I got through it, I managed to do it, passed my exam, my final exam, which was a practical exam. We have to look after our patients, that sort of thing, and basically show that we're competent and we can be a nurse. And it's not an easy exam to pass. They're like, it's one of the hardest, to be fair. Yeah. It wasn't the nicest time to have that exam, but I got through it and I just showed myself how strong I am. I had support of my friends and my family as well during that hard time, and it was just such a good feeling. I've literally just got my pin as well through, my NMC pin, so I need to sort that out on my registration. I got given my graduation degree, my classification, which is a 2-1 as I've said. I have my graduation in February because we missed the summer graduation. I still want to do nursing videos. I don't know, maybe if there's any interest out there and stuff, because I enjoy learning about things, so I might set myself a task of maybe doing one nursing video every couple of months where I'm like learning something solidly for a couple of months, learn it properly, know everything inside out, and I love nursing. I love healthcare. I love A&E. Where I kind of want to go from here though is I don't know whether I want to consider postgrad medicine. That's an option for me because I got a 2-1 in my degree. I can look at that. I also have thought about going to London or Bristol to work in the trauma areas there, or Southampton. Also looking at doing a master's possibly. I'm not sure where though. I need to have a little look and stuff, but I'm not done. I'm not done. I've got so much more that I want to do education wise and learn. I'm so up for learning, and I will continue learning for my whole life. Healthcare is one of the professions where you just keep learning and you keep learning, and that's what I love. I love being a nurse. It's an amazing career, and I would suggest it to anyone who has any interest in healthcare. It's not the most glamorous job, but nothing in healthcare is really glamorous at all. If you'd have told me 3 years ago that you qualified as a nurse and you'd be working in A&E, I would have laughed and gone, ha, good one, yeah, sure. I didn't even know that's what I wanted to do. I didn't really know what nursing was to do with. I was so naive, and I am so proud of myself. So proud of myself. I'm proud of everyone in my year who passed. Like, we worked so hard for this, and now it's finished. Yeah, I don't really know what else to say, except I'm so happy and proud. And I'll see you in my next video. Bye.